On behalf of SN Sangath team, I would like to welcome you all to this session on implementation of Mental Health Care Act. So when I talked to Amrit ji about, talking about what is a ground reality about how we are implementing our Mental Health Care Act, he said, he would rather talk about why we are not able to implement and what are the gaps that are preventing us from utilizing this act on the ground. So today, on behalf of Sangath team Essence program, I would like to extend a warm welcome to Mr. Amrit Bakhshy. Amrit ji, he would be presenting. So Amrit ji, he is a caregiver of his daughter who has schizophrenia since 1991. And currently, he is also a president of Schizophrenia Awareness Association. In the past, he has been a chairperson of the Hospital Managing Committee of NIMHANS, and he was also a member of the institutional body of NIMHANS. Amritji has also served as chairperson of the Ethics Committee of Indian Law Society. Amritji was actively engaged in the drafting and later implementation of the Mental Health Care Act, and currently also alongside working with SAA, he's also advocating for the implementation of Mental Health Care Act in India. So today he will be sharing, his presentation would be based on his own experiences as a family member, as a mental health care advocate in the country. So before Amritji start, I would like to share with you about Essence program. So I'll give you a brief description of the Essence program. So I'm going to share my screen. Okay, so can you see my screen? Babita, can you see my screen?
Yes, we can.
Yes, we can.
Okay. So thank you so much. Sangath, as you all know, it's a non-government organization. The headquarters is in Goa, and we also have projects in Delhi, Bhopal, and other cities in India. So Essence program is a 5-year research project which is funded by NIMH in the US, and it's the aim of this project is to bridge the gap between science and mental health care services. So this project has two components. One is scaling up, and second, capacity building program. So as part of the capacity building program, we have different courses. So there are courses for media professionals, there are courses for service users and family members, and there are courses, there is a series of policymaker lectures. So I know some of you have attended policymaker lectures, or some of you are members of our service user course, others are in media course. So this is a part of a capacity building program, and this particular session is organized by the team that was engaged in development of the service user capacity building program of Essence program. And so before we start, we also like to go over the ground rules for this webinar. So please keep yourself on mute throughout the session. You can keep your video off. And if you want to ask a question, you can ask in the chat window. And we are also live on the YouTube. You can, if you're on the YouTube, then you can write your questions in the comment section. Babita would be sending all the questions to me or Amritji. We will be collating your questions and we'll try to answer those questions in the session. Okay, and please ask the questions that are only relevant to the topic that we are covering today. So over to you, Amritji.
Thank you, Anna, for your introduction and for nice things which you have said about me, and also the introduction about the Essence project. Our organization SAA is also involved with the Essence project in a small way, and my colleague Dr. Amrit Bakhshy is leading this part of the project, and this program of empowering persons who have lived experience is indeed a very useful aspect of your project. And under that empowerment program, you are doing this training program. and which I believe is over. And one of the session in this program was on Mental Health Care Act 2007, which was conducted by Dr. Sumitra Patare, who is the author of this Mental Health Care Act. He did all the drafting of this act. And I'm so happy that the participants were not satisfied with one session. They wanted another session, and they requested the organizers to arrange one more session. And this is the additional session which I was asked to make a presentation. And instead of repeating what was said in the first session, they have slightly modified it, and it is about the implementation. When an act is made, that is half the battle won. The other half is the implementation of it. Howsoever good an act be, and Mental Health Care Act 2000 is indeed one of the best piece of legislations. It's a model act in the field of disability, and but its implementation is important. If it remains only on paper, then it is of no use. So today we will be discussing the implementation part of it. So I'll now share the screen. Oh. Yes. So next. Just a minute. Sort of. Okay. So now what I want to tell you is that the delay in its implementation or delay in the enactment of the act is not a new thing. You see, we had the Indian Lunacy Act, which was passed in 1912, and then we wanted another new act because it had become obsolete act in 1946-47, and some discussion had taken place, and in 1949, Indian Psychiatric Society passed a formal resolution seeking a new act. And the government appointed a committee in 59, 60, and ultimately Lok Sabha passed it only in 87. The parliament passed it in 87, so it took such a long time. And then the notification was issued in 93. That is 6 years after passing the act. I mean, it was unduly delayed. Why there was such a delay, I can't say. But it took 46 years from the time the idea was mooted and from the time the act was notified. By that time, some of the provisions had already become old and obsolete. Now, this is 1987 Act also was not fully implemented. Many of the states had not made their own rules, so they were depending upon the model rules which Center had drafted. And then almost 90%, 95% admissions were voluntary admissions, but in reality, those were not voluntary admissions. Those were supported admissions, but the process of getting a reception order would take very long, and also to overcome those delays, they would just take the signatures of the patient and admit them as voluntary patients. When wanderers were to be given protection under the Act, that protection did not come from the government. Mainly it was the NGOs who were doing the work, and they were rescuing the wanderers. Organizations like Banyan and some other NGOs like Asha Deep and all were working in that direction. And many establishments which kept mentally ill patients worked without any license. The licenses were not obtained, and establishments were not strict about that. That is how Irrawaddy tragedy happened. There were so many of mental establishments. Technically, they should have taken a license. They did not take a license. They chained the patients, and the great tragedy occurred, which drew attention from all over the world, and also Supreme Court took cognizance of that. The Act also provided that government will open more government mental hospitals. That also did not happen. After Irrawaddy tragedy, the Supreme Court also directed that each state should have at least one government mental hospital. That also did not happen. So Act was not fully implemented even at that time. Now, it also happened the same way in regard to UN CRPD. In 2006, the resolution was passed, and then India signed it, India ratified it. And as per their rules, when 20 nations ratify it, then it becomes implementable. That was in May 2008. And within 2 years, a report was to be submitted in regard to the implementation. The laws of those nations who had ratified it were to be modified, amended, or new laws were to be framed so as to comply with the provisions of the UN CRPD. We didn't do that. In fact, we started the process of amending our laws in January 2010. And ultimately, we were able to do it only in 2016 and 2017. Our Mental Health Care Act was notified only in May 2018. So there was a delay of 8 years in implementation of provisions of UN CRPD also. So you will find that there have been delays throughout. So if there is some delay, of course, now we are more conscious about our rights, about our duties. We are impatient that Mental Health Care Act should be implemented as early as possible, and the gap is being reduced also. Now this making of Mental Health Care Act 2017 also took time. As I mentioned, we had started the process in 2010, and after the second draft was made, it was found that it was getting too clumsy. Too many changes need to be made. So instead of amending the 1987 Act, we should have a new Act. So third draft was for a new Act. And after that process was completed, national consultations and regional consultations and all got over. So it was introduced in Rajya Sabha and, in 2013. It was referred to the Standing Committee of Parliament. They also cleared it. And normally it should have been passed and should have become an act in 2013 itself. Now, two things happened for which it could not happen. One was that there were Parliament's term was over, and new elections were to take place. And second was that our health secretary at that time, Mr. Keshav Desi Raju, who was pushing this act, and he was the main strength behind the drafting of the act and its speedy movement, he moved to another ministry. So as far as we, the stakeholders, are concerned, that was a big setback. And I am sure had he been at the helm of affairs, the act would have been passed and it would have become a reality in 2013 itself. Or even with the new government in 2014, it could have become an act. So ultimately, it took more years, and in 2016, it was discussed, and by the time President's assent came, it was 2018. Now this, we'll talk about the implementation of the Act. Now Act has 16 chapters and 126 sections, and there are many parts of the Act which really do not require implementation, or which are not of much concern or relevance to the stakeholders like us. See, the Section 2 contains definitions which do not need implementation. Then there are sections on finance, accounts, audit, or official members of central authority, state authority, etc., etc. So, offenses, penalties, which are not relevant really. So, we will not discuss those things. What are relevant, what are implementable and have been implemented or have not been implemented, we will be focusing on those matters. We will go chapter by chapter, we will go section by section, and we will see that what has been implemented and what has not been implemented, and most of it has not been implemented. So we will have a look at that. Just a minute, please. I am not so sorry computer wise, so okay. Okay. Now, in the definition chapter, it is stated the mental illness has been defined. Now, you see, when we have our Disability Act, Rights of Persons with Disability, now they have clearly given the number and the names of 21 disabilities in the schedule. So it's very clear. Now, in our definition of mental illness, we have given a very broad spectrum, general definition. We have not specified the illnesses, which I think is necessary and desirable. All that we have said is that mental retardation is not a mental illness, and we have said that addiction is a mental illness. Beyond that, we have not said anything in the definition part. Okay, this is easier. So now in section 3, there is a mention of standards to be adopted to decide on mental illnesses, and these standards should be nationally and internationally accepted. These have to be notified by the central government, and this should take into account these international standards which are contained in International Classification of Diseases, ICD, which is a WHO document. Currently it is ICD-10, and from 1st January 2022 it will be ICD-11, which was approved and passed, I think, 2 years back. Why it will be operative in on 1st January 2022, I do not know, but that is how it is provided. And I don't understand why our central government has still not notified that. What is the problem in that? I mean, they can simply say that the illnesses listed in ICD-10 will be deemed as the illnesses for the purpose of this act. It is as simple as that. And if some have to be excluded or included, they can be done, and it can be done later. Also, it is just a matter of issuing a notification. So without that, there is a lot of problem. Uh, like even for insurance companies, it can be a problem. What illnesses should be taken for purpose of the insurance policy or for reimbursement of the bills? In fact, most of the insurance companies all over the world are dependent on DSM, which is Diagnosis and Statistical Manual of American Psychiatry Association, for passing the insurance bills. So I find this document very comprehensive, very simple, easy to understand. Uh, it is a DSM which has been published by American Psychiatric Association, but it is not just their document. Thousands of mental health professionals work over it for years together before it is finalized and produced. So that also could have been taken into account, but because we want to go by a WHO document, that is how we have said ICD. But whatever ICD or DSM-5, that notification should come from the government urgently, which already 2.5 years are over from the notification of the act. So that is one important thing which has not been done so far. Now, treatment-related decision-making is in Chapter 2, Section 4. Now, we have a provision for nominated representative. So, when nominated representative should step in, when a person, a patient can decide for himself or one on his behalf, decision should be taken by a nominated representative. So in Section 4, it has been stated, very simple and easy to understand provisions are made. So if a person with mental illness is able to understand the information given to him required to take a decision on his treatment, that is one requirement. Now this is another thing, you see this, I'm sorry to say that it's such an important act and our ministries are so lax in it that this A, B, and C, all these three are the requirements, but they have put or. Understand the information or understand, I mean, how can that be? It is so silly. So, this is just not a careful reading. You see, any act which has to be passed has to be read carefully, carefully. And there are not many contextual errors also in the act. Because in 2013, it was before the parliament, and then again when it came before them in 2016, not many changes they had made, mainly to accommodate Ayur, this Ayurvedic, homeopathic, and Unani and all, just to accommodate. So there were additional one or two definitions. So when those additional definitions are there, then naturally R becomes S becomes T becomes U. So there are, references to those definitions in various uh, parts of the Act. Now those remained as they were. Those were not changed. So it causes so much confusion. You see, I myself had prepared corrections in those contextual errors in RENDA, and I had given it to Health Ministry with a request to send it to the Law Ministry. So Law Ministry did issue a notification making those corrections. I don't think they took all the corrections, but most of the corrections they had made. So this is A, B, and C. All these three are the requirements. If you see the act, you will find that still that R is there. So the person, if he is able to understand the information given to him, and he understands the consequences of the decision which he makes or the lack of decision, if he does not take a decision, then what are the consequences of it if he understands that? If he is able to communicate his decision or lack of decision, then it will be deemed that he can take decisions, he has the capacity to make treatment related decisions. It is as simple as that. Now, there is also a provision under Section 81 that Central Mental Health Authority will prepare a guidance document. We will constitute the committee, they will issue a guidance document to give further clarification, further instructions. Now, this is something which was done speedily by Central Mental Health Authority. Otherwise, they are mostly government. But this work they did very fast, and expert committee was constituted. And whenever expert committee is constituted, the work is mostly done in months. Others have no time, whether they are official members or non-official members. This expert committee, which was constituted by the government to go into the rules and regulations, that also Nimans was asked to do it, but then I did all that work myself. Uh, in fact, we asked for comments, it was put in public domain, and there was a big response, and there were some 600 pages of responses that we had received. I did all that sorting of those expenses, classified them, what we had put in our recommendations, what was their response, what they wanted, and what we should do it done. So now what this committee's guidance document which has come, in my opinion, it is unnecessary, very lengthy. It makes things very complicated, and this should not have been. That's all I can say. It makes it very difficult for mental health professionals. Now, the first thing is that when a nominated representative comes with the patient and says that he cannot decide for himself and I have to take decisions on his behalf, then this kind of test may be required. Otherwise, this test is not required. Now, they are saying that even if the mental health professional or the patient finds that if decisions, still this again they say that if a person comes for independent admission, he goes for with his that I am getting hallucinations, feeling very low, depressed, a lot of anxiety. So I want I want to be admitted on his own, and the doctor in charge of that mental health establishment. Yes, recently. Still, this 7-8 pages document which is there has to be filled and tested. I mean, this you should do where there is where a person has been. Now, if a person walks in, how do you want all these tests to be carried out? Increasing cost. I think this needs to be looked into by CMHA or by the. Now, advanced directive is another very controversial section. Now, advanced directive, for this, the requirement was that
हाँ वो निशा के सासू सब जाएंगे साथ में निशा के सासू सब जाएंगे साथ में हाँ रामपुर जाना तो वगैरह हम भी पहले वहाँ कर लेंगे उसको रामपुर चले जाएंगे
somebody has to mute it.
हाँ और
So this advanced directive format was to be devised by Central Mental Health Authority. Now, Central Mental Health Authority has not done it for 2.5 years. Only on 18th December, they have issued regulations in which for that we have to.
किसके होते हैं गुज्जू के होंगे और किसके होंगे
Can we mute it from here? Others. Okay. Some other sounds are coming anyway. So that Gaurav Kumar Bansal, you see, he had moved the High Court saying that government has not issued the regulations and minimum standards have not been circulated yet. So he did the pushing, and then High Court asked the central government, and then they were told that already they have prepared it and soon the notification will be issued. So that notification has come on 18 December, where that format has been given. And also those minimum standards have also been laid down. So now at least that form can be filled. Okay, you fill the form, but whom will you give it? These advanced directives have to be registered with Mental Health Review Board. Now, as on date, we have no mental health review boards. Hardly, as far as I know, you see, government doesn't have correct information. Even when the questions are asked in Parliament, they give very old and stale information. So what we gather from newspapers and various other sources, hardly at 2-3 places this mental health review boards have been formed. In Kanpur it has been formed, but there this stakeholders representatives have not been taken on that, and some other places, 1 or 2 other places, and rest they are saying that it is in the process. They have only identified the centers. So therefore, advanced directives, even after 2.5 years, have not been registered, and nobody can make use of these advanced directives. So in any case, we were opposed to the advanced directives as caregivers, and we said that you see the decision about the treatment has to be taken by a mental health professional who is trained, who decides what treatment is right for the patient. Patient doesn't take decisions about his own treatment. So Indian Psychiatric Society also opposed this. But we were to comply with this UN CRPD pressure from WHO. So this remained. So we also reconciled to that. And we thought that, you see, this Indian Psychiatric Society is opposing the act. Mental health activists are also supporting it. We also, opposing it. And if we also oppose it, it will never see the light of the day. It's a very good act with a lot of provisions, beneficial provisions. So we should accept it as it is. And see, if you want a full cake and you get 1 slice less, you should still accept it and eat the remaining part of the cake. So we supported this, but we knew that this will be only an ornamental clause. It will never come into effect, although this CMHC, they have issued booklets explaining the advanced directive, explaining the nominated representative concept. But I have my serious doubt that it will ever be used in sizable numbers. So that is about the advanced directive. I think even after 2.5 years, it is not registered anywhere so far. Same fate will be of nominated representative. It will remain an ornamental clause. Now, you see, we have some 40 and odd persons who have lived experience of mental illness and who attend our center. I don't think any one of them will ever make a nominated representative. And again, who is the nominated representative? Somebody brings a paper with the signature. Now, whether this is the latest paper of a nominated representative or subsequently it was changed, there is no way of knowing it. And then you see, another problem comes that if a person needs some treatment and nominated representative wants him to be admitted in one hospital, then he doesn't have money to spend on it. He would not like to spend on his own money. Patient doesn't have money, then he has to go to the family members. Family members will say that if we have to spend the money, we will take him to the place which we think is the best for him. We will not pay you the money and then you decide where to take him and what kind of treatment he is to be given. So there is bound to be conflicting situations. So I don't think a nominated representative provision will also ever work. And I'm also not aware whether anybody has yet made use of this provision, and some people have written documents nominating persons as their representatives. Okay. Now this is about the mental health services which are to be provided by the state. Of course, funds is a problem. We will discuss it when it comes to Now, this providing access to mental health care, access is of course there. It should be affordable. Yes, it is affordable. Government facilities are at reasonable charges in sufficient quantity. Now, this I doubt because mental health facilities provided by the government are highly inadequate. We need more such facilities. We need more such hospitals. We need more such beds. So here the government has to work. They have to provide more such facilities in larger quantity available nearby. Now these facilities nearby is interpreted as that each district should have such facilities. Now here also, I think at least half the districts have psychiatric wards with a psychiatrist. The requirement under the National Mental Health Plan is that each civil hospital in a district should have at least a 10-bed ward for mentally ill patients, and there should be a psychiatrist available. Currently, it is not so in all the places. We hope in the near future this will happen. Acute services are there, outpatient, inpatient, that is available. Now, 18(4)(b), it is not there at all. Halfway homes run by government. I am not aware of any sheltered accommodation. No beggars' homes are there. Mental hospitals are there, but away from the hospitals, whether any such facility is there, at least I am not aware of. This Chandigarh caregivers are making very, very serious efforts to get some such facility for their family members with mental illness. Supported accommodation means provided support to people who have their own accommodation, but they don't have caregivers, they need some support. So that support also, I think, is not available as on date. Services which facilitate home-based rehabilitation, I don't think any such services are provided as of now. So there is non-implementation on this front also. Community-based rehab establishments and services, no, they are not there. It's not implemented here also. Provision for child and old age mental health services are also not there. So there is a total lack of implementation in these services which state is required to provide under the Act. Now, state has certain obligations, and I would say that yes, things are being done, but not because the Act has been enacted. After enactment of the Act, I don't find anything special that has been done. This was being done under National Mental Health Plan and in general. So we have primary, secondary, tertiary level facilities, and some additions are also being done. And efforts are made that people live in community. It is not necessary to be admitted in a hospital. That OPDs are more and more OPDs are available. Minimum mental health services in each district should be available. That also efforts are on. Now this reimbursement of the cost of treatment in a non-government mental health establishment, if there is no state-run facility, that means if in a district and a civil hospital, if they don't have a psychiatrist, they don't have a psychiatric ward, and the treatment is taken in some private hospital, then the expenses will be reimbursed. So that provision is there. Some rules are also made in that regard. But actually it is happening whether somebody has really got the reimbursement, I am not aware. Okay. Now this is state's obligation about free mental health services and treatment to the people below poverty line. As far as I know, free treatment is not available. Of course, if some destitute or homeless is there, then he is brought and he has no money to pay. So for him, it becomes, him or her, it becomes free. But those who are below poverty line, they have to pay some small amount. It's not totally free from them. I was heading the hospital management committee of Nimans, so I am aware charges are very low, but charges are there for them. Then about quality and all, yes, I think quality is almost the same. Minimum quality standards. Now, center has made those minimum quality standards, and I hope similar regulations will now be made by the state based on the regulations which center has made. Now, each state has to make its own regulations. It cannot be just an adoption because conditions differ from state to state, and in each state also depending upon the regions. There are variations in regions also. Some regions require a higher level of services. In some regions, it is what is it? Some regions are very remote. You can't provide those very high level of services. So region wise, they will have to have 2-3 categories of services by each state. And medicines, essential drugs have to be given free of cost, and those are not available. I don't think anybody is able to get free treatment. That is not done so far. And then generic medicines have to be provided, which I think is not in the slide, but that is also the government's obligation, which generic medicine special centers have not been opened yet. No budgetary provisions. Okay. You see, budgetary provisions, you see some demands, representative and other people, IPS, some study was done. And according to them, for implementing the Mental Health Care Act, the government has to spend 49,000 crore rupees per year. Now, in my personal opinion, these are exaggerated amounts which are stated there. It may not cost that much. For every service which is given, cost is not involved. But government has not made any provision so far, additional provision towards implementation of the act. That is very unfortunate. So budgetary provision has to be there, and then it has to be ensured that this expenditure is really, really incurred. Now, this is what is in red is the status for the last 2 years. National Mental Health Plan, 18, 19, 50 crores were allocated, and only 5 crores were spent. In 19, 20, 40 crores, 10 crore less were allocated in the budget, and only 5 crores were spent. So this is a very sorry state of affairs. I mean, this must be corrected, this must be stopped. There should be adequate provisions, not 49,000 crores, but a substantial amount, and then it must be well spent. Those who do not make use of these allocations, they should be pulled up, they should be questioned. So implementation is very, very important, and the budgetary provisions also must be made by the government. Now, right to community living is what is government's role and responsibility. I think by and large, people with mental illness are now living in the community. They are not segregated. There are no lunatic asylums of British India or East India Company days. So on that, I won't say that we have any serious problems. But government has not done anything special in this regard so far. And now to move to a less restrictive community-based establishment. That means if a person has recovered and still he is in a government mental hospital, then that is right, that is wrong. We should move to a halfway home or some other community home. Now that is not happening. That the government has to do and ensure. And when it is not possible, it's abandoned. Now here, government has to do that. Of course, that legal support is provided, but how many people have made use of those provisions, I don't know. So they have to be educated, they have to be helped in making use of those provisions. You see, when the persons are sent to government mental health hospitals and they have recovered, then the families refuse to take them back. You see that many things, brothers and sisters think that if this fellow comes back, he will claim his share in the property. So they don't accept him back. So they have to be helped legally, and government is committed to provide them legal support without any charges. So that must be made use of. For that, government has to educate them, government has to support them, government has to help them. Now, this I have already said that halfway homes, group homes, etc., are not provided so far. This has to be done in expedited. Now, the rights of persons in mental health establishment is a list of these rights. Now, all these things must be there, and these things are not happening also. I'm not reading out what is listed in the slide, but the important thing is that there should be an inspecting agency. There should be inspection, and authorities must see whether these things are being provided or not provided. There are no mental health review boards, so their establishment of mental health review boards is very, very important. You see, the Act provides that they will hold their meetings in these mental health establishments. So when they hold their meetings there, then they will see what is the condition. So there must be formation of mental health review boards at the earliest. As many centers and districts as possible should be covered. Then only you will be able to ensure that all these rights of persons admitted in mental health establishments are met. This is a very useful document. All these things are very important, very much required, but one has to see that they are really implemented. Then promotion of mental health and now insurance. I mean, IRDAI has written several letters, but still it is not happening. Insurance companies are most reluctant to provide insurance cover to persons with mental illness or to cover mental illness for insurance purposes. Why they are reluctant, I don't understand. Mental illness, covering mental illness is least expensive for the for insurance companies, because hospitalization is minimal. It is already OPD treatment mostly. And OPD treatment is not covered generally by insurance companies. And in any case, for the first 2 years, you are not covering even hospitalization, because this is the existing disease for the people. So I think IRDAI have to take some very strong steps. They have to penalize those who are not implementing or who are not covering mental illness. I have listed 3-4 companies which are implementing. We don't have the correct list for that. You have to file an RTI with IRDAI and get the names of those companies from them. But this is a need, and also the stakeholders must realize that this act does not provide for special benefits for persons with mental illness. Not many say that what is the use if our OPD expenses are not paid or not. You see, the act only says that there cannot be any discrimination. What you give to others, you give to persons with mental illness also, same treatment. It is not asking for something beyond that. So that has to be realized by all stakeholders. Then right to information, confidentiality, etc. Okay. And now this planning, designing, implementing programs for the promotion of mental health, government has done nothing. I mean, the way you have done for HIV, the way you have done for leprosy, the malaria eradication, same kind of big, huge programs have to be done for mental illness. But I'm sorry to say that nothing has been done so far. And unless government is really pushed into it, and they have to plan, design, implement programs to reduce suicides and attempt to suicide. The number has gone up. They have done nothing about it. Okay, creating awareness, reducing stigma. No, nothing has been done. And this Times Network, they are running a beautiful campaign, Act Now. I have great admiration for that. This is something what government should be doing. giving wide publicity. Nothing has been done. I hope the other television channels also start doing some such programs to create awareness and reduce stigma. But Times Network definitely needs to be complemented at their own initiative. They are doing that. Same thing is about stigma. If the awareness is created, stigma will automatically come. I mean, you don't have to do anything special to reduce the stigma. It is more awareness, less stigma. That is the general principle which we should understand. Now, sensitization and awareness training programs, very, very important. Police doesn't know anything, judiciary doesn't know anything, and judiciary still accept this. They are passing those reception orders even now. Police officers, if you tell them that there is a beggar, there is a wanderer outside, you take him into your care. They are not aware what the rules are, what the provisions are. They have to be shown that. So it is very important that their awareness programs are done for them. I could understand from CMHCA that they are having some agreement with the Jharkhand government and Maharashtra government, and some programs will be done. But Delhi is doing some wonderful programs. High Court had directed that their Judicial Academy, Delhi Judicial Academy, to conduct 4 such programs every year. In one of the programs, they had invited me also as a speaker. That is how I know about it. So there are all judicial officers are called for that program. Police officers are also called. Jail officers are also called. Now, police officer director was telling me that those who are about to retire, who are no good, who are not needed in police station, such people are being sent because Judicial Academy, they have asked for them to be sent, so they are sending it, but they are just completing the formality. They should send their young, bright officers for this program. It is not just a formality which needs to be done. So this has to be done in a major way. Sensitization of government officials is very, very important. At the moment, hardly it's not happening. And where it is happening, that is also because courts have given directions, not the government's initiative. Okay. Now, human resource development, I would say that things are happening, not due to the Act, not for compliance of the Act, but before that also the part of National Mental Health Plan. All medical colleges have been asked to have a ward, special ward for mentally ill persons, and they have been asked to increase the number of seats for post-graduation in mental health. MD courses they have to start. Some half the hospital medical colleges have started. The rest staff also will start. So things are really happening. In prisons also the focus is on there. In each state, one prison has to have a mental health establishment. So things are not bad. And government continues to give this old stale statistics of 3,800 or 3,500 psychiatrists in the country. Just 3 days back, I was watching one program of IPS, and the president said that they have 7,500 members with them. So 7,500 psychiatrists are definitely there. Then at least 1,500 are not their members. So roughly you can say that around 9,000 psychiatrists we have in the country, and the statistics which the government keeps on repeating even in parliament or they send to the WHO are not correct, and they give a wrong impression. Now CMHCA has been formed. How effectively it is meeting and functioning, I don't know. It should function more effectively. That is all I can say. And I would also say that it has to give a fair representation to all regions in the country for the non-official members. And the present delegation is that, and that is, if you have a look at the list, you will also see that most of the non-official members are from Delhi only because of the proximity, but they must consider members from other parts of the country also. Now, SMHAs are not functioning. Only 19 states have formed SMHAs out of 37 states and union territories. And there are many irregularities. I will think time is not there. Otherwise, I would have narrated how irregularities are happening in these state mental health authorities, maybe some other time. These prohibited procedures, of course, ECT, I don't think anybody is doing a direct ECT, so this compliance is there. Sterilization as a treatment, I'm sorry to say that prohibition is more in breach. All those who are females particularly, who are wanderers and they are brought to mental home, they are generally, not everywhere perhaps, but in many cases, their uteruses are removed. And in case of mental retardation, to 100%. In many NGOs, I know they admit women patients only if the parents remove their because they say patients cannot take care of themselves and we also cannot take care of this part. So now this no chaining, I have visited in many mental health establishments. Patients are being chained. Patients are kept in isolation wards, which should not happen, but it is being done. And restriction on psychosurgery is there, but this clause should not have been there. It should have been totally prohibited. Why restriction? It should be total ban. I was told when I was opposing this in the 2010, 2011 that psychosurgery should be totally banned. I was told that in Imhans it is still being done. So when I became chairperson of their hospital management committee, I asked the director, do you still perform psychosurgeries? He said that he is in service 30, 40 years, whatever he mentioned. In his time, it has never been done. So why do you have such clause, such treatment in your books, which is barbaric, which is cruel, which does a permanent damage to the brain? Now, apathy, government's apathy is definitely there. And this X got passed that also I think many of you would be knowing in 2016. You see, there were a lot of problems in both the houses that I think monetization issue was there, demonetization and the special status for Andhra, that issue was there, and every day the house was not able to function. And in the winter session, hardly any business could be elected, and then budget session was there. And government must do some business, the houses must do some business. So as I was told, or as I understand, the secretariats were asked to find out some non-controversial bills which will not be opposed because Rajya Sabha government had minority. So these two acts were dug out, these two bills were dug out, mental health care bill and the rights of person with the disability bill, which already the parliament committee had cleared, and there cannot be any controversy about that. So these two were pushed and these were passed. Otherwise, perhaps even as on date, these would have remained bills only. So what important thing I have said in this last slide, that we are huge numbers. The entire population is affected by mental illness. In each family, you will find one member or more than one member who have some kind of mental illness. They have experienced some time in their life, or they have, at any given stage, they have this mental illness. We can make a very strong lobby. We should tell the MPs how many votes our people with mental illness have. We should emphasize, we should fight for it. You see, this people with disability sector, physical disability, they are much less in number. but they get the things done. This Parivar, this National Trust Act, they are part of it. I mean, they can get things done. Many times this Ministry of Social Justice and Empowerment, they have, mooted some idea or some changes in the act and this and that, and they have to take back because of this very strong lobby. We should have so strong. We are a divided house, unfortunately. Despite our numbers, we are not able to get things because we are not united. We don't have any strong leadership. So what I would say that we must pressurize the government to have a separate mental health department in the Ministry of Health and Family Welfare. You see, the Ministry of Social Justice and Empowerment, they have a separate disability department with a full sector. That is how they are able to get so many things done. They have a separate department for Ayush. So same way, we must have a separate department in the ministry because the number is so large, the problem is so huge. A separate mental health department with a full sector should be there. We should ask for it. We should take the help of local MPs, I have already said, and we should take help of judiciary. We are taking that help now, and judiciary understands our problems and they help also. We should continue to take their help. These are some of the suggestions I have. These are some of the strategies. Thank you very much for listening to me patiently. I think this an hour or so that I have taken. Thank you very much.
Thank you so much, Amritji, for such an honest overview of our Mental Health Care Act. We would now be answering the questions. So some of you had submitted your questions in the form. So I'm going to take those first, and then we would be taking the questions that I get in the chat box. So some of these questions have already been answered during the presentation, but if you have any more questions, please write them in the chat window. Amritji?
Yes.
I'm reading out the questions that we have received in the form, in the registration form. So first question is, can the autonomous government organizations be held responsible for doing things right only for the papers and not on ground? What is the process?
This is a very general question, okay, and hypothetical one. The question is very specific and related to our subject for discussion. You see, it's not mentioning the mental illness or mental health or specifically some case it has been done on paper and not in reality. Of course, if it is not in reality, then those people have to be questioned, the officer responsible, action has to be taken departmentally, or one can go to the court also. But what I would request that questions which relate to Mental Health Care Act or its implementation, those questions.
Okay. So second question is that, why is it that the CMH, the central government and state governments continue to ignore court directives on the implementation of Mental Health Care Act?
No, they are not ignoring it. They can't ignore it. If they ignore it, it will be the contempt of the court. What I can say that they are slow. They implement direction of the courts. They ask for more time, and many times they get reprimanded also. You see, court secretaries from various states and reprimands them for slow implementation, give them some more time, and then they ask them to implement. So, you see, court will not take a very strict action against the government because these different arms of the constitution, they must work in harmony. But yes, reprimanding is there, and whatever court's directions are there are not taken lightly by the government.
Yeah. Next, there is a question where people want to know about specific population. For example, there are questions about, how does Mental Health Care Act in the context of homelessness? So what is the special provisions for people who are homeless, for youth, for young people with mental health conditions. So are there any specific
Homeless youth are two different things. I mean, homelessness, there is a provision that if is a wanderer and it appears that person who is wandering on the streets has some kind of mental illness, the police officers in charge of the police station of that area must take that person in his care. And somebody from the public can also inform the police station that such a such person is wandering, and that person should be taken into police care. Within 24 hours, that person has to be taken to a hospital. And the hospital, that government hospital, the patient will be examined. And if that person has a mental illness, that person will be sent to a government mental hospital. If he doesn't have a mental illness, then he will be sent to a beggar's home or some some similar government facility. So that provision is very much there. The other similar provision is there that if a person is in government mental hospital and that person has recovered and he doesn't know where to go. I mean, his family's details are not known. The family had given some wrong address because they don't want him back, or they are refusing to take him back, as I mentioned, because the property share he will demand or he will be a burden or something. Then the legal support also can be provided by the government. That provision is also there.
Okay, thank you so much, Amritji. Then there is a specific question about schizophrenia, whether a person with schizophrenia who has a disability certificate, are they eligible to get reservation for medical post-graduation course?
Yes, definitely.
Yeah.
There is 5% reservation for persons with disability or disability, right? And 1% is for mental illness and other disabilities related to mind. And so under that 1% quota, and the age relaxation is also there for 5 years, they can definitely seek admission. And in jobs, it's 4% reservation. In higher education, it is 5%. They must take advantage of these special provisions made for them. And, yes, and they have got jobs. Many people have got admissions for higher education.
Amritji, in addition to this, there are some questions in the form as well as in the chat window that I received, which are related to the ethical considerations for practitioners like psychiatrists and psychologists.
Yes.
So are there, like, there are, Shivani has asked a question related to confidentiality about, psychiatrists seeing patients in a hall. And there's another, Preeti has a question related to whether how does one address the grievances related to therapy? Is there any provision within the Mental Health Care Act where you can?
The provision for confidentiality is very much. It has to be kept confidential. Only if the government agency, some courts, law, they ask for the information, it can be shared with them. Or if the nominated representative wants that information, it can be given to him also. That also this new clarifications which have been given, it is provided that you have to, for nominated representative has to prove that the person with mental illness cannot function, cannot take independent decisions, needs support, then only this information will be given to nominated representative. So confidence is already there. If somebody is examining all the other person is also there, of course, confidentiality is compromised and it should not happen. Normally, patients are seen in private room only. This must be some exceptional case that they are being seen.
And what about grievances? How do they get addressed? I know Mental Health Review Board is one place to address these grievances, but we don't have mental health review boards in most states. Almost all, none of the states have mental health review boards that are functioning. So there's a question about that. How does one get the grievances or ethical issues addressed
The
related?
solution is that review boards must start as early as possible. The other, you can also approach this mental health authority, state mental health authority. If the review board is not there, they should look into it. And finally, you can also go to the court. But you see, the persons with mental illness who are staying in this mental health establishment, they do not have that time or money or the ability to go to the courts for such things. So solution lies. I think government has to be rise to start. Without mental health review boards, it cannot function properly. For implementation, something is required most urgently. It is the formation of mental health review boards, and there are hardly any cost because they are not full time there. They don't have any office. They can meet in any of the mental health establishments. Every mental health establishment has to make some provision where their meetings can be held. Uh, it is, I mean, this question instead of this, what they should do. Well, what they should do is that the families and all, they must go and pressurize and get them formed or go to the courts and tell the courts, look, at least ask government to set up the mental health issues. And it's happening also.
Thank you so much, Amritji. There's a question that, has the pandemic, COVID-19 pandemic, has it impacted the implementation of Mental Health Care Act in any ways?
Well, it has affected all aspects. So implementation also has been affected, and in any case, there was not much of implementation. So, but still, it has affected to some extent. What is important finding of IPS, I think it's, the participants should know that IPS carried a study, and they came to the conclusion that due to COVID-19, 20% increase in mental illness is there. So if we had 20 crores people with mental illness at any given time, now their number has become 25 crores. So that increase is very much there, and implementation also has been affected to some extent. Yes. So, because the focus is on COVID and not on other aspects.
Yeah. So there are young people in the team, in the audience, who want to know that what is the role that young people, that youth can play in implementation of Mental Health Care Act.
No, you see the implementation of the act, if it has not been implemented, then they have to approach the authorities in groups, because groups always sort of pressure groups become very effective. They should also get involved with some NGOs who are working for persons with mentally ill and their families. And they can give their time and resources. That is one way of helping, not directly for implementation of the act, but they can help for the cause. Helping for the cause is very important.
Okay. I have taken most questions in the form, and there were some questions related to the challenges, which I think you have already covered in the presentation. And your last slides covered, what needs to be done, what are the challenges, specific challenges, and how service user families can come together. Is there any other question, Babita, that you have received from participants?
No, Mona.
Okay. Okay. So there is a comment from Rita from Samban Foundation that SMHA in Haryana is functioning, and Samban Foundation also has the NGO representative in SMHA in Haryana is from Samban Foundation.
Very good. Congratulations, Rita.
Yeah. Congratulations. Yeah. And congratulations, Rajiv. Rajiv is also in the audience.
Here, he's there in the audience.
Yes, I can see Rajiv. Congratulations, Rajiv. I know Haryana was one state where it was fraught with many problems.
So Rajiv, you can help your constituency by being an active member of the SMHC. My best wishes to you. Yes.
Okay. Okay, so if there are no more questions, so I would like to say thanks to Amritji. Amritji, thank you so much for this wonderful presentation of Mental Health Care Act. I never understood Mental Health Care Act so well, and it was very helpful. We have a very mixed group in the audience today. We have service users, their families. I know there are some mental health professionals, there are NGO representatives. So I could see that this presentation did help all the groups that are there in the audience in one or the other way. And as you said that we are a huge number, service users and families together. We are a huge number. This is our strength, and coming together. So what are the gaps and limitations, problems have been in the implementation of Mental Health Care Act? Best way to commemorate is to come together. So that message from you, Amritji, would stay with me. I have written it in my notebook.
Good. Thank you.
That remembering our strength. The strength is that we are a huge number now. And thank you so much, and thank you to everyone in the audience for taking our time over the weekend and attending this program. We also have this link on the YouTube. So those of you who could not attend the session, you can go on the YouTube channel of Sangath and watch it. Amritji, would we be sharing the PPT, the presentation that you used today?
Yes,
Can we share it with the audience? Okay, so Babita would send a presentation to everyone present here.
yes.
Okay.
We
Okay.
want knowledge to be shared, awareness to be created.
Yeah. Okay, so I would also like to thank Sangath team for organizing this webinar. And I would also like to take this opportunity to announce that this webinar was a part of our service user capacity building course of Essence project. We have finished the first batch of our service user program. With Amritji's presentation today, we officially end the first batch, and we will soon be starting the second batch of our service user program in last week of February or in first week of March. So this service user capacity building program is for people who are living with the mental health condition or are caring for somebody with mental health condition. So either you have somebody who has a mental illness, or if you are a family member or a friend, so you can do this course. This course is to build your capacity to understand about mental health systems in India, and to see how you can increase your engagement as a mental health advocate in community building activities or at the governance level. So those of you who are interested, you can write to Babita, and we would intimate you about whenever the applications for our second batch are out. Okay.
Thank you. And
okay, and thank you so much, Amritji. Thanks once again.
Thank you, Amritji, Mona, and Anilji for this webinar from Sangath and Bhopal Hub team. Yeah, the webinar
Thank you,
was
Babita.
very interactive. Yes, thank you so much.
Thank you so much.